Good afternoon, everyone. This is Megan Dotson, and we have Pam ready to go today. I forgot I'm on camera. Oh my goodness. Oh wow, I wasn't prepared for that, guys. Anyway, we'll let people get connected here and start in just a second. Can you tell me how to disable the waiting room or do it for me? I can't remember. Okay, I think we got everybody connected, Pam. So why don't you feel free to get started when you're ready? Thank you.
Okay, all right. And will you just let me know, are you seeing the PowerPoint saying preparing your behavioral health program?
You bet.
Excellent. Okay, well, welcome everybody to the third of 4 training modules on preparing your behavioral health program for funding opportunities. And today is the day you need to strap on your seatbelt because we are going to go. I'm going to walk you through how I end up doing this. When I identify a funding opportunity, how I kind of set the whole thing up to begin writing the grant. So today we'll select a potential funding opportunity. We'll use the funding announcement to inform your development of the grant application, and then we'll identify some key information to include in an implementation plan. I love this video. You might remember, or this picture last time we had getting ready, and it was a Native woman and she was stretching, like getting ready to run a race or something. And so now we're getting started, and this, I assume this is a dog, but he is rocking and rolling and he's going after it. So that's how we're going to be today. We are going to get after it, and we'll start now. We're going to go to SAMHSA.gov. That's the Substance Abuse and Mental Health Services Administration. We're going to go to their main website. So now what I'm going to do, let me see, I'm going to do a new share. I have to practice how I do this because I have to do this kind of live. So we will now go to, let's see here. Okay. Show all windows. Okay. Now I'm not sure if it's going to work, but let me try here. Okay.
Yep, we can see the SAMHSA website page now.
Okay, what I want to do is go to the one right before it. So let me try one more thing here. Just bear with me. There it is, right there. Oops. What happens is the little toolbar gets in the way. Okay, now let's see. So for whatever reason, it's not letting me go to the website. So luckily I prepared in case this happened. And I think I just had too many things open because of my registration process. But what we'll do is we will go ahead and new share, and let me try this. Okay. What you would have seen if you went to SAMHSA.gov is you would have seen the SAMHSA website. Under the SAMHSA website, it has a little tab called Grants. And when you click on the grants, this screen that you now see should pop up. Does this screen say fiscal year 2021 grant announcements?
It does.
Excellent. Okay. So just pretend you went to .gov, SAMHSA.gov, that you clicked on grants, and lo and behold, it will send you to this screen. And what you can see when you start scrolling down is that they have some, different information that you might want to read about. But here is where the magic happens. So, and just confirm, do you see a chart now that has lots of different grant opportunities?
Yes, ma'am.
Excellent. Okay. So what happens is you'll scroll down, and what you'll do is you'll look for this column that says application due date. Okay. And that lets you know when the opportunity, the funding opportunity, has to be submitted. So you can see that these early ones are back in January, February. The lower you scroll down, usually the newer ones pop up, but that's not always the case. But so here you'll see we have one right here called Community Mental Health Centers. That's due next week or a few days. It would be impossible to apply for that in 4 days. It's just too much to pull together. Here's one right here, but I think this is a national training opportunity. I think you'd have to be a technical assistance center to apply for this one, but you can see some prevention ones. And and by the way, let me point out one other thing. Don't get seasick as I scroll here. You're going to notice that the beginning of the grants, see where it says center. These are the Center for Mental Health Services. So all the mental health ones come first. And then you'll see right about in here, we switch to CSAP. So these are now going to be the Center for Substance Abuse Prevention. So these will all be prevention grants that say CSAP. And then when you get down to here, you see it changes to CSAT, the Center for Substance Abuse Treatment. So these will all be treatment. So that's because SAMHSA is an umbrella organization, and under it, it has 3 centers: Center for Mental Health Services, Center for Substance Abuse Treatment, and Center for Substance Abuse Prevention. So just for grins here, what I'm going to do, you can see all of these are already kind of past due. So there's nothing open. One was due yesterday, a first responders one was due yesterday. When you get down here, this has to do with different grants that were funded in the past. I don't normally fool with that too much. But anyway, I'm going to go back up and I'm going to look at this one called Tribal Opioid Response Grants. And so if I clicked over here on View Awards, it would show all the tribes that got that grant. But what I'm going to do, I'm pretending like I'm you, that I've just reviewed this funding opportunity. I'm going to pretend that this funding opportunity is live, that I can have plenty of time to apply. By the way, plenty of time is usually 30 days to 6 weeks. That's usually the most you ever get, which is why I always propose writing so much of this in advance. So what I'm going to do is this is all hot links. I'm going to click right now and see if it will take you. Did it take you to something that says Tribal Opioid Response Grants?
It did.
Yay. Okay. So this is now the grant I clicked on, and it tells you when is it due. It gives you a little description. It tells you who's eligible, which is basically any federally recognized tribe or group or a partnership of tribes or consortium. It tells you how much money is available. It tells me how many awards are going to be awarded. And by the way, if you have never gotten this award, it's almost guaranteed. They never get enough respondents, and they fund basically everybody that comes in. If you even make just a halfway decent attempt at applying for this 10-page grant, you'll get it. So there's supposed to be another one coming out soon. If you have never applied for this, remember, you can do prevention with it. You don't have to do medication-assisted treatment for opioid use disorder. You can do anything for opioids and stimulants, and it can be prevention or treatment or recovery support. It depends on the amount you apply for. But anyway, so you read, yada, yada, look how much money is available, 37 million, which again, they haven't spent it. You don't have to have match. That's very important. Nobody wants to have to cough up cash match if you don't have to. It tells you who to call if you've got any questions about the program itself or about the budget. And then all the way at the bottom, it tells you what you need to apply. And basically, these are all the forms down here, the typical federal forms that you fill out for every federal grant. But you have a choice of picking. I'm going to go ahead and look at the grant application. And you have a choice of either PDF or Word. I always hit the Word because I like to cut and paste straight up from the application itself. And so I find Word is easier to cut and paste from. Okay, if you'll just verify, do you now see the Tribal Opioid Response Grant itself?
Yes.
Good. Okay. So one of the things that I do is I read through this very thoroughly. Okay. And I use my highlighter. So
wait, Pam.
Yeah.
1 second. I don't think we are on the right thing. It says application materials, FOA document.
Okay, well, good. I prepared for this. So now I'm
Okay.
going to do something else. I went ahead and downloaded it in advance because I was afraid that would happen. So
Mhm.
I'm just going to show you what would have instantly downloaded. Now, do you see something called Department?
Yes.
Yeah, you see the
Yep.
actual grant application. Good.
Yep.
Okay, so this is what would pop up if you hit that hot link that I showed you. Okay, what I do is I go through and I start reading this and I use highlighters. So for example, I first see that this is due on March 19th. I go over to my little highlighter and I highlight it pink, which is as close to red as I can get and still read. And I call anything I highlight in pink is what I call a fatal flaw, meaning if you don't pay attention to it, you will not be able to be eligible for the grant. They'll throw it in the trash or they won't even open it when you send it. So can you see that I highlighted that pink?
Yep.
Good. Okay. So I keep going and here, really, even though this is a 33-page document, there's only like 10 or 12 pages that are the most, actually it's a 78-page document, but you only have to pay attention closely to the very beginning. Now, this is important because this tells you what is the purpose of the funding. Well, you know, there's no reason for me as a grant writer to make up a different purpose or a different goal. They spell it out. This is what they want. So any text that I'm going to copy and paste from, I'm going to highlight in yellow. And I do this just to remind myself that I'm going to go back and maybe borrow some of this text later. So the goal here is to address the opioid crisis. Instead of it saying in tribal communities, I might say in the Navajo Nation or, you know, in whatever the, you know, Sisseton Wahpeton tribe or whatever it is that I'm applying for. I'm going to, and pretend this grant were something completely different for, let's say, a drug prevention program for a school. I would say it's for the XYZ school. So I use their wording, but I retrofit it or change it to match my local situation. Okay. And then it also says you can address stimulant use disorders. And then the whole rest of this is very important. So not only, it also is to reduce the unmet treatment need, to reduce opioid deaths, and to provide prevention, treatment, and recovery support. And if you want, also stimulants, which could include meth. So this little yellow paragraph is going to become the backbone of all of the goals and objectives that I will be creating later in this grant writing seminar, because that is usually the most important information that you can have in the grant is going to come right like that in the very beginning. Okay, so then it tells you a little bit more. I do want to make sure if it says what time the grant is due. Okay, so that's nothing I want to worry about there. So it tells you that you must register, you know, so if you're not already registered in the federal system, it takes up to 6 weeks. It typically really doesn't, but you want to start right away. And this is something, once you register once with the feds, I think you're good for years, or at least for a year. So if you're going to apply for federal grants, make sure you get registered and follow that guidance. And they're really helpful. They'll walk you through it on the phone. This is a repeat paragraph, so I'm not going to re-highlight it. Okay, this is important. Tribes will use a result of a current needs assessment or carry one out to identify gaps. That I'm going to have to remember to include that somewhere, so I'm highlighting it in yellow. Recipients will be required to describe how they will expand access. Okay, so all of this that's in yellow, I'm going to be using that text in my writing at some point. And again, I'll modify it a little bit. Okay. Then it'll go on and on and on. I'm not going to read every paragraph here, but you'll read through and you'll identify the key language that you think is important. Okay. And it does say that that you have to use the funds to support evidence-based treatment and recovery supports, which I've already shared with you how I feel about that. To me, with, you know, Native American culture lasting thousands of years and all the oral history and all of that, to me, I would not question whether something is evidence-based if a Native tribe applied for something. Now, I'm not your funder, so that's easy for me to say, but there are ways that you can integrate your Native cultural practices with something as simple as motivational interviewing or trauma-informed care, something kind of generic, and then you feel like you're hitting this evidence-based threshold that they want. Okay, this is important. So I'm going to, key personnel. It reminds you that this person, the project director, has to at least be, I'm going to do this in green because this is a budget. So by putting that green, that reminds me whoever does the budget, which is money, which is green, needs to make sure the project director is at a minimum a half-time position. So you get the hint of what I'm doing here. I'm going through and I'm highlighting. I would do this with, if I print it out, which is how I really like to do things old school, I would use markers, highlight markers. I would write little notes in the margin or whatever. But if I'm doing it electronically, I just use my highlighter that you get in Word. Now, this is extremely important. Required activities, okay? I'm gonna make that red because it is, you're required to do it. So if you don't have the right activities, you run the chance that your grant will get kicked out. Now I'm going to come back to this section, but it tells you, that you're supposed, okay, this is, you have to have the grant has to be up and running by the 4th month after the award. That's really a key thing. If you receive more than 150,000, you have to prioritize MAT. That's medication assisted treatment. If you come in at 149,999, you don't have to do medication assisted treatment as a priority. And by the way, just in case you ever want to apply for this again, you don't even have to deliver the medication yourself. You can refer people to it. But if you do get more than 150,000 a year, just know you're going to have to refer people, even if you don't do it yourself. So now we're into the meat and potatoes. It says here, recipients are expected to select activities from the list below. Now it's interesting because most grantees assumed we had to do all of these activities. And actually, I think the feds do kind of expect you to do that if you're coming in for the full dollar amount that you're allowed to come in for. There's a list that tells you how much each tribe's allowed to apply for. And so the bigger the amount of money, the more of these are going to want you to do. But I'm going to come back and show you, a couple things here. You got to do a strategic plan within 60 days. I made that pink. Anyway, so you can see all these activities. Okay. There is no reason for you to scratch your head and make up, what are we going to do for this grant? Let me get a team together and let's figure out what we're going to do. They hand it to you. They hand you what you're required to do. Now, how you get there is up to you. There are what we say many roads to Rome. So how you get there, sure, that's negotiable. You sit with your team, you figure out, well, how are we going to, let's look at the second bullet, implement workforce development activities. Okay, that's basically training and technical assistance and how to make sure your staff has the right credentials and skills in order to implement the grant. Well, you're required to do workforce development, but do you notice it doesn't tell you how many? It doesn't tell you when you have to start it, right? If it's a 2-year grant, maybe you stagger this and you start this in 6 months and you worry about this other thing first, but where your creativity comes in is you might sit with your team and say, now, what kind of training do we need to do if we're going to implement a tribal opioid response activity? If we're going to implement treatment, which includes a Western medication for opioid use disorder, are there things that we need to do to make sure we're going to get good traction in our tribe? We better start doing some really good education around what is an opioid use disorder and how it affects the brain. And people just can't quit on their own because they want to, that their brain is kind of held hostage and that it takes a long time for the fog to clear. And that if somebody were to not use medication and try to quit cold turkey and they went back out and used, they could likely die of an overdose. So we need to let everybody know how important the medication is, how it is an option. It's not a forced thing. We need to educate our tribal leaders about how important this life-saving medication is. So you would sit and decide what are your trainings going to be, and you would describe that later as I'll show you. But you can see that these activities clearly provide the scope of work that you will agree to perform if you get these funds. Then in addition to the required activities is what they call allowable activities. Now, for me, I say, who's a smart shopper? If I have a limited amount of money and I have to do a huge laundry list of required activities, I'm probably, quite frankly, not going to sign up to do allowable activities. Why would I add more to my plate that I'm already required to do? Now, if some of these allowable activities are easy or they're more important to me than the required ones, sure, I'm going to take that on. So as an example, I would absolutely take this first allowable activity, incorporating culturally appropriate and traditional practices into my program design. I would do that because that's just the smart thing to do if you're a tribe trying to implement a federal grant and to get as much of your native resilience and culture incorporated as you could. But when you start going down here, okay, this only had 2 options. Sometimes this list goes on 4 or 5 things. And this one says that you can provide something called contingency management. By the way, that's a super effective program where you can actually provide little incentives if people come to treatment or get get negative drug screens or show up for certain meetings and things like that. So that does help your success. So, maybe I would sign up for that, but I'm just pointing out, notice there's a difference between allowable and required, and you pick your poisons, as they say, whatever you think you can handle. So I'm going to blow past all of this for a few minutes, and I'm going to show you what I then do. So I would go through this whole thing. I would read, I would highlight, I'd probably read it 2 or 3 times. One of the things in here that I would highlight in pink, and I haven't seen it yet, but it tells you that not only is it due on whatever day it's due, but it's due by 11:59 p.m. Eastern time. So especially if I lived in another time zone, I would so make sure that I had that highlighted so that I did not, put it in Central Time and miss the whole grant, because there is no coming back once you miss it. It says it cannot be longer than 10 pages. I would definitely highlight that. And because if you turn in 11, they're gonna, often they'll just not even review your application. So these are what I call fatal flaws, these really important things. Okay, now these tell what attachments you have to have that go in there. So for right here it is. This is 11:59 and it is Eastern time. So I'm gonna make sure I have all that. Okay, now what I'm going to do is I'm now going to go to what's called the evaluation criteria. And that tells you what it is you're going to write to. Okay. So here is section A, and I'm going to start copying. And I'm going to copy section A, section B, section C, section D, whoops, there, and E. There we go. That's it. Then you get into the budget. So this section A through E, I did not mean to make that pink. I meant to make this nothing, because I'm going to copy and paste this onto a blank sheet right now. So let me get rid of no color. Okay. So now what I'm going to do is, this is what your 10-page narrative has to be. This is your program narrative. It goes A through E. Come to mama. Okay. Let's try it again. So I'm going to copy and paste this, and I'm going to put it on a blank page. Luckily, I anticipated I would screw this up, and I made a copy. So pretend I copied. Huh?
Yep. Pam, I was just going to jump in. I think it's because you have the highlighter turned on. If you don't click on the down button, click on the highlighter button itself, and you can turn that off, and you'll go back to your regular.
Thank you. Yep. I learned something. I love to learn something new every day. And thank you, Kate. That was very instructive. And voila, looky there. Look what I can do. Very exciting. Now, just see if you can see this new blank page where I pasted it on. Or do I have to do a new screen share? Do you see it?
I see section A, population of focus and statement of need.
Good. Okay. Excellent. Okay. So I had it right and I was trying to go back. There we go. Okay. So is that what you see still, section A?
Yes.
Good. Okay. So you can see I literally just pasted this out of the grant. I always give myself an extra space. By the way, I don't know if can you see where I'm pointing my little arrow? I call this a nyet. My husband makes fun of me. It's actually called show hide, but I always just call it a nyet or a paragraph marker. But can you see that I'm pointing to it?
Yep.
Yeah. I always turn that on. That is absolutely critical when you're writing a grant or you're doing anything with formatting. If I were to print this page, you would not see all of those things. So they hide, but it tells me where all my spaces are. Now, what the very first thing I do after I paste this section A through E, sometimes it only goes to D, every grant's different, is I remembered, and if I had gone through every page of that grant, you would have seen that you're required to do this in Times New Roman 12. So I'm going to go up here after I highlighted all that text. I'm going up to Times New Roman, and I'm going to go over here to 12. So I've now made it the right number, the right font size. But you can see that there's a lot of space in between some of these and so there's something a little off with the spacing. So then I go up and I go to this little tab called paragraph and I click on it and I go down here and I want 0 spaces and I want it to be on single. So 0 before, 0 after each line. And I want single spacing because you don't have 10 pages is not a lot of room. I need every inch I can get. Now, remind me, let's see, don't add space between the paragraphs. Don't add the space. And you click on it. I'm gonna take it off. I don't even remember what that does. But anyway, so I say, okay, oh good, perfect. So now you can see that it really kind of scrunched everything down. And now I have the least amount of spaces. I can see 1 space between each thing. Now, you are required to leave these little numbers. So section A1. I can get, once I answer each of these questions, I can get rid of all of this and I can just say A1 and then I can type my answer. Now, I'm not going to do that because I leave it to the very bitter end. I'm just going to hit undo here and go back to where I was. I leave it all in there until I'm 100% sure I have answered every single question that they've asked. So, because look at how many different things are embedded here. Describe the extent of the problem in the catchment area. That means whatever area you will be working on, whether that's your tribe, your whole tribal geographic area, whether it's a school, whether it's a region, whether it's a county, whatever is defined as where you're going to implement this program. So you have to describe the problem in that area. It includes, what are your service gaps? Document the extent of the need. What is your prevalence rate or incidence data? In other words, what's the current amount of drug use happening or mental health problems happening for whatever population you're going to serve, what's that? Or is the population of focus going to be kids or going to be adults? Is it going to be elders? Is it going to be everybody, all ages? Is it going to be pregnant women only? Is it going to be only males out of the criminal justice system? So whatever, sometimes the funder tells you who your population of focus is. It'll say pregnant women or correctional offenders or whatever. And sometimes you get to pick. And I caution you to be very careful when you pick your population of focus, because as I may have mentioned before, when you're required to implement an evidence-based practice, if you're going to serve everybody, you might end up with 4 or 5 different evidence-based practices, because what works for a toddler may not be what works for an elder and everybody in between. So what I tell people is, if you want to serve everybody, knock yourself out. But if you have a multi-year grant, maybe you start in the first 6 months serving the younger population, and then you go to the next 6 months and you hit the next group, so that you casually, slowly, gradually, strategically begin to add new people to your service mix in a way that you can manage more effectively. It tells you here you can use SAMHSA's national data. If you don't have local data, I showed you how to do that, I think, in the very first module. Tells you where to go for it if you don't have local available data, which is nice, so they don't hold it against you if you don't have local data. And then discuss whether funding will be also used to address stimulant misuse. So this section A number 1 is got 5 different things you have to answer. And so until each one of those is fully answered and I go back and check and double check, where did I answer that question? Then I don't eliminate this whole thing. Sometimes what I do is I'll do something like this. After I'm all done answering, I'll do this and I'll put ... And then I start writing my answer. And that way they can see, oh yeah, what was number 1? It was describing the extent of the problem, but sometimes I just put A1. So just try not to forget putting those little numbers. So anyway, what I'm going to do now is I'm going to show you how not only do I copy and paste this whole thing to create the template that I will now write my narrative grant to, but I copy it a second time. I go to a blank screen and I paste it on again. And I'm going to show you something else I'm going to do with it. Tell me if you saw that I repasted this a second time. If not, I have to reshare a screen.
I think so, yes.
Okay. What I'm going to do now, all I did was paste the same little template on a brand new screen. Now I'm going to highlight only where you see words. I'm not going to start up here where this little yit is. I'm going to only highlight the words from the very beginning, and then I stop right here. While it's still highlighted, I go up to the word insert on my menu, and I go to the little thing called table, and I insert a table. Did it show you that I inserted a table?
It did.
Good. Okay. Now I'm going to hover right here, and I'm going to drag this last little line over there a bit. Now I'm going to go back up to the top. I'm going to put my cursor right here, right where the next little column would go. And I'm going to say insert. Oh no, I know I right click. I'm going to put my cursor right here where I want a column to go. I'm going to right click. I'm going to see table properties and see if I'm going to insert a column. Let's see if that does the trick. No, that didn't do it. Sorry, gotta highlight it. There you go. Highlight it, insert, try to right click. There it goes. Insert a column to the right. Okay. So now I'm going to drag that back a little bit. I'm going to get rid of all these little extra numbers that it put in. That'll mess up my numbering. I'm just going to go to, I don't know why it did that, but it does. And get rid of all my numbers. Okay. Now I'm going to go right back and to the top, and I'm going to insert one more column. So again, I'm going to kind of highlight. Let's see. I'm going to go insert. Actually, I didn't even need to highlight. I just need to hover where I want it. Insert columns to the right. Boom. Okay. Now I'm going to then highlight this top row. I'm going to right click again and say insert row above. So, oops, wait, I'm sorry. I wanted it below. Sorry. Here, insert row below. There we go. Now, I'm going to highlight all 3 of these rows. I'm going to right click again and I'm going to say merge cell. And now I'm going to create, this is going to say content, this is going to say who, and this is going to say when. I always like to center these up. I'm just kind of weird that way. Go back to home and go back to my little centering tool. There we go. So what I'm creating, and this is why I always save a little space at the top. It's kind of hard sometimes to add a little header here if you don't leave yourself a little space to add a little title or whatever you want. So this is now my action list. Now, what I may do is I may add another little row. So I'm going to insert a row below. Maybe give myself one more little row. Insert row below. Now, because I am not a glutton for punishment and I don't want to write this whole thing myself and end up in a straitjacket at the mental health institution, I am going to split up. I'm going to invite my staff to my party. So it's not going to be just a party for one. Everybody's invited. So I'm going to now say, okay, who is going to describe the extent of the problem in the catchment area? including the gaps and the need. Okay. I'm going to maybe cut this little piece out, and I'm going to make it its own little section for right now. And I'm going to then do this little section right here. And so now what I might do is say, okay, you know, I'm going to have Ren. Oops, Ren is going to be responsible for describing the extent of the problem and the gaps and all of that. And I want her to send me my first draft on May 25th. And then who am I going to assign? I want somebody to go to SAMHSA. I want them to go through all this data, these data, and find something I might be able to use. And I'm going to make that our data guy, Sam. So I'm going to assign it to him. And since that can be something that only takes a day or two, I might want that back on the 22nd. So you can see how you literally can take this whole same template that you write the grant from and create an action list. And I would go down, do the same thing. I'm going to merge these cells to create, this is section B. I'm going to insert a blank row up here to have who, or no, this is called content. And then this is again who, and this is when. And I'm going to go through this whole thing, this whole little template. I'm not going to do it now. I'm just trying to show you how to do it. And I'm going to make myself an action list of who is going to do what and when. And so somebody's going to ride herd, as I call it, on all of these things. And so, you know, even this table, I'm going to have that become somebody else's separate thing to do. So someone else can do this other part, describe how you implement your required activities of the grant and how it'll meet the goals. So you can see how you just go through this whole thing and look at this. So this is 2. Identify the practice that you're going to use or practices or evidence-based programs, and then how each is chosen and what outcomes you want to achieve. That's almost 3 separate steps. Those might take, you know, having someone go online and copy and paste a summary of an evidence-based program that you can easily find online. I could have my staff assistant do that. That's literally a copy and paste if I tell her where to go and what program I want. But then why did I select it for the population? That's going to be somebody that has a lot of understanding of the population we're going to serve and how that aligns with whatever practice I want to pick. So that might be a separate person. And then the outcomes I want to achieve, usually you'll find those outcomes listed somewhere in the EBP itself, in the evidence-based practice. But if not, I'll have to think outside the box and create those. So I'm going to go down and do this whole thing. And pretty soon I have a nifty action list. So I'm going to stop there and see if we have any questions before now we're going to go back and start working on the actual grant itself, on the template. But let me stop and see, does anybody have any questions, even about, you know, how do you insert a column, or how did you, you know, whatever, any questions at all about where we are so far?
Feel free to unmute yourself, guys, if you'd like to, and ask. There are no questions in the chat. Okay. And you can always interrupt me because I'm looking at my screen. I'm not looking at the participants or the button. What do you call or the chat? So feel free. I don't get offended. You can interrupt me all day long. All right. Now I'm going to do new share, and I'm going to go back now to my other template. And where was it? Virtual slides. I think it was this one. Yeah. Okay. So here's the template now again that we're going to write to. So the very first thing that I would do is, if I were you, is to make sure I know, let me point out one other thing. Okay. This says approximately 1 page. Okay. Now I'm just telling you how I do it. Okay. I know from being a former grant reviewer from many, many years ago, I know what it's like to sit in a room with grant reviewers, and I know how many of them think. And I know that many of them, because they're human and how human nature is, that you kind of begin to make up your mind of whether or not you feel good about this application pretty early on. Sometimes as quick as section A or B, where you're like, wow, this applicant's really got it together. They've got a good finger on their pulse of what's happening in their tribal community. Wow, they really have thought this through, you know. Or you go like, what? Like, what are they saying? Like, they didn't even answer the question. Like, if they can't even answer the question and we're in the honeymoon period, what happens after we get married and we fund them? You know, are they going to like drop the ball? Are they going to not respond? Are they going to not turn in their reports? You know, so you start kind of developing your opinion early on. As a result, I really like to come on strong in section A. I like section A to make sure I answered every single nuance to every single question that they pose. And sometimes, quite frankly, it takes a little more than a page. Now, will I go beyond? Will I go 1.5 pages? Yeah. Will I go much beyond that? No. I don't want to borrow too much real estate from the other sections, because if I go over in section A a half a page, that I don't get an extra half a page to my 10 pages. That means I got to short another section somewhere. Okay. So, so that's one thing to note. The other is that you only get 10 points for this section, whereas section B, you get 30 points. So do I want to spend all my time and burn up my clock on fooling with section A, even though it is the first thing you read and you're making a good impression, like it's your first date or something? You also, at the same time, don't want to go overboard where you spend so much time on section A, you run out of time to really focus on the sections that give you more points. So that's something to think about. But these are approximate. So, you know, as long as now, some grants, not SAMHSA, but some grants will tell you it can only be 1 page or 3 pages. So pay attention to whether they use words like approximately, but just know if you go over or under, it doesn't change your total page limit. You're still stuck with your final page limit of whatever they tell you it is. All right, now, so what I'm going to do is I'm going to go to my tribe. I'm going to go online. I'm going to go to, if we have a strategic plan, I'm going to start looking at what do I have that I can start putting here that will describe the very first thing is the catchment area. You know, if I'm in, let's say, Pine Ridge, South Dakota, I'm going to make sure that my grant reviewer, who may have never been there, who may not even know where it is, I'm going to make it so clear that it is as if they were looking at it on Google Maps or they were sitting in this community itself. So if it's very rural, if it's very remote, if it has pockets of poverty, if it has anything that I feel is absolutely critical, if it has mountainous terrain or long stretches of land without, you know, like if you're where it would be dangerous if it were icy storms, if I broke down and there's no gas stations, you know, I'm going to want them to, I'm going to describe this in a way as if they're there, because ultimately whatever that is what the clients, the families or the people that are going to get the service that you're going to be getting if you get the grant, they're going to have to navigate that terrain. And so I'm going to describe it good, bad, ugly, whatever it is. If it's this very beautiful, you know, serene setting, and if there's, you know, all the families are all located in neighborhoods and they're all very connected to one another and there's all this strength and community, I'm going to say that. If it's barren, remote, and isolated, I'm going to say that. It is what it is. And there's no reason to paint it in any different picture, especially if you're trying to get funding. You want to make sure that anything relevant is revealed for this reviewer who may not know anything about it. So I'm going to go look, I'm going to start Googling. I'm going to Google the name of my tribe. I'm going to go to the website. I'm going to go, if there's such thing as a Chamber of Commerce, or if there's even Wikipedia, if there's anything that I can start to find really good descriptive language, I'm going to start pasting it in this section. I'm going to literally just paste it right in there. Now that will be there, and often I put that in a different color font, like I might make it all navy blue. And that's just to remind myself that I need to change that text. I'm not, unless I then, if I quote something, I can keep it exactly as it was written on the internet. But if I'm going to change it around and I'm just going to use some of the compelling words and kind of create my own description, once I'm all done with that, I'll change the font back to black. But I often will just keep something navy blue or a different color just to remind myself, this is kind of, this is just random text that will inform the development of this section. It's not ready to go, you know, ready to submit. It's just like a cheat sheet. Think of it that way. Okay, but to make sure that I do not screw this up, and believe me, as a grant reviewer, you would be shocked how many people just don't even quite answer the question. I'm going to start the first sentence and I'm going to say, so before I'm going to describe the extent of the problem in the catchment area, I feel like I need to first describe the catchment area. So I'm going to kind of reverse order a little bit this sentence. So I'm going to say the catchment area that our proposed project, and by the way, I always recommend naming a project. If you name the project, then then the project, it makes it like it's more real. That it's, you know, that you're more invested in it, if that makes sense. And so it's something that I think is, gives, it's not that it gives you extra points, but what it does is it gives them more confidence, I think, that it's a real thing. So I might say the catchment area in our proposed Thrive, I'm just making this up, Thrive project is ... By me stating that sentence so clearly, I know that whether I finish the sentence or this paragraph, or whether one of my partners on the grant writing team party, that they will make sure it's that clear. Then I'm going to go back and it says, describe the extent of the problem. So then I'm going to say something like, while our tribal community has many strengths on which we will, or many strengths we will, let's say many strengths we will leverage to benefit Project Thrive. Project Thrive. While our tribal community has many strengths we will leverage to benefit Project Thrive, we also have many problems and challenges, ... So what this is doing is it is setting up the structure to make sure that none of this is left to chance, like fill in the blank, you know. So now I'm going to say, I go to the next sentence. So I'm going to come back and I'm going to fill these sentences in to make, you know, whole paragraphs at some point. Now it's the next thing says, service gaps. One of these problems involves service gaps. Oops, God, I'm a terrible typist. Service gaps for individuals with opioid and stimulant use, because I'm going to maybe go for both. One of these problems involves service gaps for individuals with opioid and stimulant use disorders. A few examples include, and then I'm going to leave that blank and I'm going to go on to my next sentence. And then I go back and it says prevalence. So incidence and prevalence. Okay, so the prevalence, and I hate when they use complicated terms like these for people writing grants that are usually community grassroots folks, because unless you're, you know, an epidemiologist or a scientist, you may not even know what those are. So, and hopefully I won't screw this up for you, but as I understand it, the prevalence is how big of the problem, if I were to stop time right now and just take a picture of what it is like, the drug problem, or if this were prevalence of mental health. I know this is a TOR grant, so it has to do with drug use. But so if I were to take a picture of the drug use right now, what percentage of my tribal community is using opioids? What percentage are using some kind of stimulants, cocaine or so that point in time is the prevalence. Incidence is new cases. What's coming on new? So right now, point in time, I might have 10% of my tribal members might be currently today having problems with opioids and stimulants. However, the new cases could be on the rise. So if maybe the new prevalence might be 20% of new cases of use are starting this year. That tells me I'm going to have an upward trend. I don't want to turn this into a complicated subject. And if you have an evaluator, they're the ones that would, you know, maybe help better identify. But the most important thing is that you have whatever data you have is the data you have. Use whatever you have. And if you don't have it, then go to this website, like I showed you on module 1, and download whatever they say at at SAMHSA, the Tribal Affairs Office. And I believe it was something like 9 or 10% of all Native people have an opioid use disorder, and of adults 18 and up. And I would just take 10% of my total population of 18 and up. So I might say something like, while our tribe does not currently have the benefit of a comprehensive needs assessment, including incidence and prevalence data for opioid and stimulant use disorders, then by applying what is it called up here? I'm going to even copy. I'm going to say by copying. By applying and I'm pasting this right in, the SAMHSA's by applying SAMHSA's national data on American Indian, Alaska Native from the Survey on Health against our adult, because I do happen to remember they did it for adults. I don't know if they did kids separately, against our adult population, means that approximately, and I'm making up this number, y'all. Okay. So let's say you had, just to keep it easy, let's say you had 5,000 adults in your tribe that were 18 and up. And then SAMHSA says 10% is the number of American Indian Alaska Natives that have a substance use disorder. So I'm going to say that means that approximately 500 of our adult tribal members currently have a OUD, have a opioid use disorder, or I wonder if stimulant use disorder is SUD, because that also means substance use. I'd probably just spell it out, stimulant use disorder. So you can see what I did there. I just made sure that I answered that question. I used if I had my own tribal data, I'd use it. And even if your data tells you something else that relates to drugs, and then maybe you include both, whatever little data you have, and then you also add this other thing. So you're just trying to kind of paint a picture. And then I do want to go for stimulant use. So I would say, as a result of our concerns for both substances, we will address both of these disorders in Project Thrive. Okay, now I feel like I'm going to go back. I'm going to go back right here. And what I also like to do, by the way, is I know this is kind of crazy, but I like to do that. Like I separate my prompt. I call these a prompt from the narrative. And then I also like to do this, and I'm going to eventually take off this part that says 10 points, approximately 1 page. I'll get rid of that before I submit, but I also like to capitalize this. And I'll tell you why. It sounds kind of crazy, but the reason I do it is that it looked like it changed it out of Times New Roman. Let me go back and fix that. Okay. So what I'm going to do is the reason I like to capitalize is I like to, sometimes if I'm out of room, I run all these sections together. And so sometimes the only way you can easily tell that you've left section A and gone into section B is if it's bolded and it's all caps. So you know, oh, okay, now I'm going to the reviewer knows, okay, now I need to assign my points and go to the next section. So anyway, that's why I do that. Now, what I've done here is I have created the technical, I have now technically and actually I just caught a small, this just shows how picky I get. It says discuss whether funding will be used. And I said here, as a result of our concerns for both substances, we will address both of these disorders, I'm going to say, with Project Thrive funding. I mean, I literally do not want to leave half of a point on a table. I don't want anybody to short me because I didn't technically answer the exact way that they asked the question. But what you can see by doing it this way is while I have now created a skeleton for section A that ensures that if I finish all these sentences, and there'll be several paragraphs here. So probably I'll make that its own paragraph. I'll have a beautiful, compelling, catchment area description that makes you just want to be right there. Then I'll probably have a paragraph that talks about what the problems and challenges are. I'll probably have a separate paragraph about the gaps. We have an outpatient program, but it's got a waiting list of 2 months, or we have an outpatient program, but only for youth. We need something for adults, so I'll describe that there. And then, and maybe that's probably all I'll have, or maybe I'll make this into 2 paragraphs, but you can see that with filling these out, I will end up with my 1 page. I'll also probably put a little picture I'll try to find online, and they usually have them, a picture of the tribe's jurisdiction. So it might show, there's this many counties or this many neighborhoods or whatever in our tribe, and we're going to be focused on the one that's in pink or whatever. So I might put a little tiny map or a little thumbnail sketch or a little photograph or something. So I might have that, but you can see I've now just finished section A in terms of the structure to make sure I don't leave any points on the table. Now, this is the last section I'm going to work on right now for today, but I'm going to show you this other little trick. Any questions so far? And
not in the chat, nope.
Megan, can you ask folks while I'm doing something here if this is making sense so far? Because I know this is, I'm definitely in the weeds.
Sure.
That was by design.
Okay, yeah, if you guys could put in the chat whether
or a thumbs up or something if this is making sense so far, or if I'm losing people. Okay. Oops. Stop that. What did I just do? Okay. Now I'm moving on to section B. This is so important because it is worth the most points of any section. And I'm going to show you a little trick right here. Now, this is not rocket science. Read this one sentence. Describe how you will implement your selected required activities okay, and how these activities will meet your goals and objectives. Okay, now, that's really kind of two things. So how will you implement the activities? So I'm even going to make these like their own separate. Now I got to be careful because I only am allowed to use the numbering that they give you, which is they only have a section B1, but I'm going to have a little paragraph here. So now what we're going to do is we're going to go back to the actual funding opportunity announcement. So I'm going to do a new share. I'm going to go back to the tour announcement. Okay, and I'm going to go back where I showed you the required activities are, which was in the kind of in the beginning. And tell me, do you see, Megan, that I'm going back to the required activities? Do you see?
Yep, your highlights are all showing up. Yep.
Yep, good. Okay. So now these are, and just so you can see that I'm under required activities, that's the title right there, required activities. So I'm going to, for the moment, I'm just going to unhighlight my little pink because I'm going to do something else with it now. Go back and do no color. Okay. And all right, now I'm going to highlight all of these required activities. And if I was going to do allowable, I would also highlight those. But for right now, just to keep it simple, I'm going to go ahead. I'm going to go back to my grant. What's a new share again? I have to keep remembering to go to my new share. And I'm going to, where was I? I think I'm here. No. Golly, where was it? Oh, here we go. Okay. Okay. So these are the required activities. Are you seeing now a list of bullets?
Yes.
Okay. What I'm going to do is I'm going to unbullet them and I'm going to make them, I'm going to make them Times New Roman. Remember, we have to do Times New Roman. I'm going to go back to my paragraph. See, this one has 12 font spaces in between. I want 0 spaces in between and I want it on single. Okay, now I am going to take these required activities because we're required to also show our goals and objectives in this section. And I am going to make required activities. I want you to know somebody's mowing my lawn. Let me close the door. Hold on. Okay. I'm going to make these required activities objectives. These are going to become my program objectives. Why in the world would I sit around and torture myself into creating arbitrary objectives when they spoon feed them to you right here? So the first thing, so I'm going to unbullet. Let me just unbullet a couple of these just to demonstrate. Hopefully you guys can still hear. Hopefully this dude, I don't have a very big yard. Hopefully he'll hurry up. Okay. So what I'm going to do is I'm going to show you how to turn these into objectives. So all I'm going to say is, now keep in mind, these are things you have to do. So there's, so I'm going to say by, because what happens with an objective, it has to be time limited. So by XXX, I'm going to put in a date there at some point, complete a comprehensive strategic plan based on the most current epidemiological data for the tribe to address the gaps in prevention, treatment, and recovery services. And I'm going to get rid of identified by the tribe because I am the tribe at this point. So that is now, so I have an objective. By such and such a date, I'm going to complete the strategic plan. Now, this already told me it has to be done within 60 days of award. So even before I'm going to sit and worry about what day of the week that is, I'm probably going to just cut it. And I'm just going to make that my timeline. So by 60 days of award, complete a comprehensive strategic plan. Okay, so now I have an objective. My next one, this one doesn't give you a time frame, so I'm going to have to make up my own dates. By XXX, I'm just going to leave it a placeholder for right now until I talk over with my team. How long do you think it'll take us to get workforce development and training activities going? So by such and such a date, implement workforce development activities to ensure individuals working in our tribe. No, I'll say tribal community because you might be working, you know, beyond your tribe. You might be bringing in other systems like, you know, correction systems or school systems that might not be in your exact tribal area, but might be nearby. But you would make this make sense for you. To prevent and treat opioid, and I might say, and stimulant use, because I've already told them I'm going to do stimulants. Okay. So what I'm doing is I am converting all of these required activities into objectives. Now, what you'll notice is some of these can, like, look how big this is. This is ridiculous. Okay. I'm going to turn this, if I decide I'm going to do medication assisted treatment directly, I'll say that. If I'm going to do it the referral, I'll say that, and I'll make this a one sentence. I'll just say, you know, by such and such a date, you know, by XXX, implement service delivery models for using medication assisted treatment. That's probably where I'd stop it right there. And then if it's by referral, I would say, you know, through referral. If it's directly, I would say directly. Now, let's just stop there for now. And let's think about, well, let's do one more. So, okay, let's stop right here for a minute. Okay. Now, let's go back and think, okay, now I have objectives. So let's say I carry this all the way through and I have objectives. What an objective tells you the overarching thing that you have to do and when it's due. But what it doesn't do is it doesn't give you all the gory details of how you're going to get it done. So if I'm going to have a strategic plan done in 60 days, what are all of my strategies? Because these are called the required activities, which I've turned into objectives. So I'm going to call this objective 1. Okay. And I'll even like bold it here.
Pam, one question that Linda had is it possible to show quickly where the requirements verbiage was from which the objectives are based?
Correct. I will show you. So let's go back and do new share. I'm going to go right back to the TOR. This is the TOR. This is the grant application we started with an hour ago called Tribal Opioid Response. And in the very beginning, within a couple of pages, here we go. It says required activities. Every grant, by the way, even if this weren't SAMHSA, if this were HRSA, if this were CDC, almost every grant now has a section called required activities. Well, if you're required to do those, that's all you do, you know, and you can bring them to life a little bit and make them your own. But see, you can look down here, all these things you see in gray, that's where I got them right off literally verbatim, right off the funding opportunity. So now I'm going to go back to where I was because I want to show you something. Let's see, I always lose my place. Please let this be it. No, it's not. All right, just gonna have to bear with me a minute while I go back and figure out which one of these many things. I have so many screens open now. I want to find where I was. I think it's here. No, here it is. Okay, good. All right. So all I did is I added the word objective 1. Okay. And here I'll make this objective 2 because I'm going to show you another little trick here. So here's objective 2. Okay. And I'll just keep going. Objective 3, if there's 7 required activities, I'll have 7 objectives. All right. Now, so if by 60 days I have to have a strategic plan, just saying it as an objective doesn't make it happen. I got to have some steps. So I'm going to call this strategy 1.1. Yeah, okay. So what am I going to do? I'm probably going to hire a consultant to guide our planning process. Or maybe you've got a tribal leader that's going to do it. You know, arrange with our tribal leader to facilitate a strategic planning process, strategy. I'm only going to do a couple because you only have 10 pages. So they're not expecting every little thought you ever had on the planet to be in here, but you want to give the grant reviewer that you understand the meat and potatoes that go in here. So hire a consultant to guide our strategic planning process, develop or complete an initial draft. And I do not put times on these right now. I only timed the objective, just so you know. I did that on purpose. You're welcome to put dates, but again, I'm trying to keep this simple. It's only a 10-page grant, and they haven't required me to put that level of detail. So I'm going to complete draft 1 and share with all tribal members on our tribe's website. I'm making this up, but however you would want to get the input of your tribal members, or maybe you say, have a meeting to unveil, and then maybe the last strategy, 1.3, would be gather input from the tribal community, maybe even get it from some of your tribal partners, and finalize and submit the plan. Okay, so I'm now done with objective 1. And then I'd go down to objective 2, and I would start, I'm just going to only do one of these here. So this will be strategy 2.1. Strategy 2.2, so I just do it like this. So if I'm going to implement workforce development activities to ensure that people that work in our tribal community understand how to prevent and treat opioids and stimulants, then I'm going to my first strategy might be develop a list of training topics needed by our, what are we calling ourselves here? Our tribal community members, tribal community members and programs, or something like that, so that individuals and programs in the community are going to understand what is opioids, what are stimulants, and I'll go down and go on it and maybe give two more. I'm going to develop the list of the training. I'm going to, maybe the next one is prioritize the top 5 trainings, and then schedule the trainings. That's it. I'm done. So I'm now done with, so you can see literally this takes minutes, and I'm already now giving shape to the to this whole section. And and I'll do this all the way through. Prioritize the top 10 trainings for implementation. So I'm going to implement some trainings down the road, and then schedule the trainings. Schedule and hold. Good. Okay, so I'm almost done here. So I'll keep on going like that. Now, what I'm going to do, because I have objectives, you'll see I don't have a goal. So the last thing I'm going to do here, go back to the new share. I'm going to go back to my tribal opioid response funding opportunity. And remember, I told you I highlighted a bunch of things yellow that were important. I forgot, but here it is. So I'm going to go to the very beginning, and when it says the program aims to address the opioid crisis by increasing access, okay, and to reduce unmet treatment and opioid deaths through the provision. So what I'm going to do is I'm going to grab this right here, and I'm going to make this my overarching goal. I'm going to go back to my, I'm going to go, whoops, I got to go to new share. And then I got to go back to my, and I'm going to make this, I'm going to call this overarching goal. Whoops, overarching. I don't want to have a goal for every single objective. So what I'm doing, I'm going to put it back in the right font, Times New Roman. I'm going to bold that goal. I'm going to get rid of all my funny spacing. I'm just fanatical that way. 0, 0, single. Good. Okay. So now I have an overarching goal to reduce unmet treatment need and opioid overdose related deaths through the provision of prevention, treatment, and recovery support. And I do desire this. And so I'm going to get rid of that. And stimulant misuse and use disorders. So I have a big overarching goal, what my whole project's going to do. I already have all my objectives that are mapped exactly back to the required activities. And so not only am I doing that, I am going to tell the grant reviewer, this is something I always tell people, remember who you are writing this grant for. You are writing it so that a grant reviewer who is going to make the decision as to whether this gets funded or not understands what you're doing. So I'm going to say, grant reviewer, I do this all the time, note, to ensure that, now I'm gonna go back to I'm gonna do a new share real quick. I want to go grab their exact language. I'm going to go back to the funding opportunity. And I'm sorry this is clunky, but this is the only way I can do it. I have to show you the actual, you know, I have to go back and forth with the funding opportunity. But I'm going to go back to this funding opportunity. I'm going to go back to where you get your points assigned, where I created the little template. Here it is. And it says, I'm going back to section B. Remember it says, and the wording is so important, describe how you will implement your selected required activities of the grant and how they will meet your goals and objectives. So I'm going to copy this little sentence. I'm going to go back to my goals and objectives that I was writing here, and I'm going to paste in those words. I'm going to turn it all into Times New Roman so I don't get dinged for having the wrong. To ensure that our selected required activities of the grant are implemented, we have converted the required, and I'm even going to make them in capital just like they did, required activities into our project drive objectives. So grant reviewer note, to ensure that our selected required activities of the grant are implemented, comma, we have converted the required activities into our Project Thrive objectives as seen below. And then I'm going to say, furthermore, we have aligned our overarching project goal with SAMHSA's goal, SAMHSA's funding goal or funding opportunity goal. Lastly, we have developed a number of strategies to implement each objective. Something like that, I'm going to tell them. So I basically said, you don't have to worry about whether we're doing our required activities. We've turned the daggum things into goals, into objectives. And so there we have it. Then I'm going to also say, moreover, moreover, to ensure that that we implement all of these objectives and strategies, we have included them in our project timeline. So what I'm going to do, like pretend that I did this all the way down through all 7 or however many of these things we have. You're going to see I started objectives. Oops, I know I'm so fanatical about just bolding. I just like to make things look really crisp and clean and where it doesn't all bleed together and you can just make sure everything's easy to find. But what I'm going to do is I'm going to start with these objectives, the ones I've already done. And I'm going to demo it on this same page here just to show you. When I'm all done with these, I'm going to find a blank spot on a grant. I'm going to paste them again. I'm going to get rid of all of my little paragraph markers so that they all run together. I'm going to highlight them, only the words. I'm going to go back up, insert a table, and insert the table. Look at how I've already got my timeline going, guys. And then I'm going to put in, a column here, insert column to the right. And I'm going to put, and I'll have to go back and see what it says the timeline has to be for this grant, but it'll say something like, you know, for now, I'm just going to say, and put one more, insert columns to the, okay. So I'm going to make sure I line up with my margins and I'm going to add, I think this is when the due date is, and this is going to be who does it. I think it's who and when. And then I'm going to add a little row above and it's going to be called project timeline. And I always like to customize it, project Thrive timeline, and then who, and then when. And I'll center that up nicely. And then I now have my timeline. And so I'm going to even remind the grant reviewer here. I'm going to say, please note that all of our required activities are noted below with the letters RA. So I'm going to go back and because I know that every objective was a required activity, I'm just going to call it an RA there. And I'm going to call everyone that was an objective, I'm kind of converting it back to RA for required activity. Because again, this is a timeline that's going to go in a different section and they want you to know. So when they see, I might even call this required activity 1, required activity 2, you know, and I'll list, I'll list all my required activities. Now, not only am I going to do that, but in my timelines, I like to start with a few other key tasks. So I'm going to insert a bunch more rows. And let me make sure these are not bolded. Okay, good. So I'm going to say alert, alert tribe, alert tribal members and partners to grant award. Because you're going to want to make sure everybody knows if you get the grant. That's the very first thing you're going to do. I'm then going to say, alert tribal members and partners to grant award, alert leaders and media to grant award, to position the project for sustainability. I'm going to say for high visibility and sustainability, for high visibility. So in other words, I'm going to make sure everybody knows, hey, y'all, we got the SAMHSA grant. I'm going to let the media know. I'm going to make sure the tribal leaders make the announcement. I'm going to get buy-in to position the project for, I know I'm even going to say that, to position the project for buy-in, comma, high visibility, comma, and sustainability. Then you've got things like, got to hire staff. So I'm going to say hire diverse staff from ready applicant pool, because I'm assuming that you have people that are ready to go or that you can make ready to go quickly. Don't forget, you've got to what do you call when you get ready for your project by having order supplies, you know, for timely project startup. So I just start adding in all my random things that you would want to do. And remember, I told y'all that last module that it's really, there's no reason why these things right here, these things right here, these first 4 things I highlighted, those are things that you can start writing a timeline right now for, because these are the steps you're going to do no matter whether your grant is whether it is a what do you call a grant for this man is putting fertilizer, weed killer on my rose bed. Jeez Louise. Sorry about that. It was a little distracting there. Anyway, so you can see that these steps would be the same no matter what you're doing, no matter if it's a pregnant women grant, whether it's a grant for opioid use, whatever it is, you're going to be alerting the media, you're going to alert your tribal leaders, you're going to be ordering supplies, you're going to be hiring your staff, you're going to be doing all of these things. So basically, it's very important to make sure that you have these in here. Now, the other thing that I do is I put a little key. I do a partner key, staff and partner key, and then I'm going to wrap this up. So staff and a partner key. Come on, Pam. PARTNER. I got to put it in the right font. I know it always wants to default to Arial for some reason. And I'm going to say here, I'm going to do, because I don't have room here to put, so I'm going to call it project. So project director is going to be equals PD. And let's see, tribal leaders will equal TL. And so that what I'm going to do is I'm going to think about all the people, if I'm going to involve child welfare as a system for some reason, if that makes sense for my grant, I'll call it CW. So when it says who, and then I'll do one that says all staff equals AS. Evaluator equals EV. So that what'll happen is as I am saying who, so who's going to alert the tribal members, well, maybe that'll be the project director. And who is going to alert the media? Well, maybe that'll be the project director and the tribal leaders. And who is going to do the staff hiring, PD? Who's going to do? So then I go through and I only have to put the little initials and I have my little answer key up here. And so that it saves me a whole lot of room in my chart. And then by the date, I'll put my different dates in. So I'm hoping that this was helpful to you in understanding how, and so let's say I get this whole chart done, and I have quite a bit of it already. Okay, look at this. I've literally written probably a third of a grant, maybe not. No, maybe I'm being ambitious. Not quite a third, but you can see how much. I'm going to go back now to my grant. And I'm going to figure out where do I put, I think, where does my timeline go? I don't even know where the timeline goes. Maybe you didn't even have to do one in this one, but I'm glad I showed you. I feel like there is one here. But at any rate, for now, I'm going to go ahead and put it in, put it right here. But normally, almost every single SAMHSA grant, you're required to have a project timeline. So you can see how your grant can begin to take shape by just putting the structure together to make sure that you meet all the points. So we have one more session next week. And so we'll finish up a little bit of this and answer any questions you have on this. And then we're going to wrap it up with a few other tools and templates. But I want to stop and see first if we have any other questions from y'all.
There's nothing in the chat at the moment, but please feel free, you guys, if you have something to ask Pam. Otherwise, we'll wrap up.
Does this make sense? Was I getting any yeses or thumbs up, or was I getting?
Yeah, it did. They did. They said everything makes sense. Very helpful to make sure all requirements are covered.
Yep. Good.
And then Troy had a question. Will we have access to your example at the end?
Sure.
Yeah.
I'll clean all this up and I'll send it to you before next week's class.
Sounds good. I can,
God, I'm inhaling pollen or something.
sounds like you
Sorry.
need to, you've only been talking for an hour and a half straight.
I know. And sorry that this can't be interactive, but the nature of it is, we have 2.5 days to show you how to do this. And and I'd like to be very hands-on and just show it and demo it. So, all right. Well, listen, y'all, look forward to our last session next week. And if you have any questions, feel free to reach out. And good question, Troy, and I'll make sure we get these examples to you.
And people said, thank you and great presentation.
Wonderful. Okay, y'all, you take care and have a good day today.
Okay. Thanks, guys. See you
Bye.
next week. Bye-bye.